So just to give you the context for this work, many of you know that Aboriginal life expectancy is about 10 years below the general population, and they have poor outcomes on pretty much every measure. So I was seconded into the Centre for Aboriginal Health a number of years ago now to work with the director to lead a process to develop a new 10-year Aboriginal health plan. And around the same time, a couple of reports came out from government. One Commonwealth government report that basically said that past approaches to addressing Indigenous disadvantage have failed and new approaches are needed. And a state government report that basically said that although we're spending significant amounts of money and despite modest improvement in some areas, Aboriginal people continue to experience poorer outcomes, and that the cause of disadvantage are inextricably linked and complex. So in entering into this position and working with the director to think about how we're going to develop a new 10-year Aboriginal health plan, we really didn't want to do and take the same approach that government always takes. We really wanted to try something different and see if there was a different approach that we could take that really recognised the complexity of the problem and the links and interdependencies, and really tried to shift the dial and make an actual difference for the system. So that was our ambitious approach. And so we looked around at like what organisations we could get to help us think about this differently, and looked at a few organisations and ended up working with an organisation called RIOS, which works internationally at addressing complex social problems, and has worked in places like South Africa and around the world, and also here in Australia. So Kerry talked a little bit about complexity, and just to give you another lens on it, this is the lens that RIOS uses and some other organisations use just to try and frame complexity. So a problem can be complex if it's got one of these three characteristics or all of them. So dynamic complexity, where cause and effect are far apart in space and time. And so if you think about Aboriginal disadvantage and the cause of that going back potentially to colonisation and government practices over the last 200 plus years. Social complexities, where actors have diverse perspectives, and then generative complexity, where the future is unfamiliar and undetermined. So in thinking about the dynamic complexity and cause and effect being far apart in space and time, I really wanted to look holistically at the situation and to see how we could bring that together and to look more deeply at the causes of the problem and what's actually happening, and how we can really try and address those causes rather than just work at a surface level, which is what otherwise we would probably tend to do. So I'm sure many people have seen the iceberg model before, just as a way of thinking about how we address the causes of problems. So really trying to get below the waterline and to really unpack what's currently happening underneath the surface. So what are the patterns that we're seeing? What are the structures that are supporting those patterns? And what are the mental models that are supporting those structures? So to give you an example of what this could look like, an event might be someone goes to a GP because they want to address their smoking, and the pattern might be trends in smoking rates and, some evidence of some programs that have helped before in addressing smoking. And the structures might be the different organisations and how they're working together to try and address smoking rates. And then the mental models might be what society thinks about smoking and why people decide to smoke in the first place. And trying to think about how you can address those mental models and how people think about things, rather than just working at a surface level to look at the interventions that happen at that level. I thought Kerry's Burke example was really interesting in terms of thinking about what the mental models are in terms of the way that men think about themselves and the way the community thinks about themselves, and how you start to shift the way that you think about yourselves and then the impact that you have. So just to tell you a bit about what we did in terms of practically speaking. So we wanted to develop a new 10-year Aboriginal health plan, and to do that in consultation with communities. So RIOS conducted some dialogue interviews. So they spoke to 30 leaders across the Aboriginal community controlled health sector and the public health sector. And then we ran 8 workshops across New South Wales for about 350 people, and took a vertical cross-section of the system, so from senior leaders to frontline workers. and then held a health and wellbeing forum that was hosted by the minister, which had all the senior decision makers in the room to, at the end of the process, decide the future directions for Aboriginal health. And then we also had a written submission process, so getting written feedback from stakeholders as well. And the convening question that supported all of this work was, how can we together transform the way that we work and collaborate to significantly improve health outcomes of Aboriginal people across New South Wales over the next 10 years? So that question really drove all of our work and was the question that really brought all of those processes together. So just to unpack a little bit more how the consultation processes were ran and what made this different from how government would previously potentially have consulted with Aboriginal people. So some of the features that we really tried to make sure that were there were that the Aboriginal voice was heard, and that we tried to create an equal and shift the power dynamic between Aboriginal people and government. So the way that we did that was making sure that in every consultation there were more Aboriginal than non-Aboriginal people in the room, and that the Aboriginal voice had at least that space to get heard. And in terms of, so this is the framework that really supported the consultation process, and it shows how we moved through from the surface level into understanding what's actually happening at a deeper level in the system. So if we start at point A, which is the challenge in terms of the current situation that we're facing, we don't actually know what point B looks like, in terms of we don't know what the desired future is. So it's really hard to try and get there unless you go through a more deep process of uncovering what's happening in the current situation, and then taking some time to step back and reflect on what's happening, and then creating together the future. So what we did in terms of uncovering the existing reality is to really look and seek feedback from the Aboriginal people and non-Aboriginal people in terms of what's currently happening in the system. So what are they seeing? What are the themes that are emerging from what they're seeing? And really played that back and shared perspectives so that people could see different parts of the system. And so, for example, we had people in the room that would be working in a particular geographical area with other service providers that they've never been in the same room as. So they've never been able to see the system from another service provider's perspective, let alone a community perspective potentially as well, because they've never had the opportunity to be in the same room together and to see those different perspectives. So we spent quite a bit of time trying to get to a shared understanding of what the current system looks like, so that the public health representatives could see from the Aboriginal community controlled sector what the system looks like, and vice versa. And then, some interesting things from that in terms of Aboriginal community controlled organisations, saying, for example, they have 30 different funding streams coming in from government, and government not being aware of how much different funding streams were going into one organisation, and the impact on that organisation in terms of just basic reporting back to government on what they're doing, and how that's taking all their resources potentially away from delivering even better services, and also not giving them the opportunity to join up their services in how they provide them, because they're having to report against all these different silos of funding. So to really try and unpack some of those features of the system and what's currently happening. And then having some time to step back and reflect, and then look together at what a different system could look like, and what's emerging. And so one of the features was that we didn't walk in with a pre-scripted idea or hypothesis, and we didn't have any real understanding what was going to come out of the consultations. We really walked in with a blank piece of paper and really wanted to see what emerged out of it. And what would come from the people in the room, rather than testing an idea. So that was the process that we went through, and some of the voices that we heard. I'll just let you read this for a minute. So we really tried through the process to help people shift the way that they work and the way that they related. So we really tried to create a space where people could have dialogue and really connect with each other rather than coming from an oppositional viewpoint, and really tried to build the relationships between the service providers and between the different stakeholders that were present. And so the outputs that came out of it were 7 joined up building blocks for the system. So I was really trying to basically create what the essential parts of the system were and how they connected together to form a whole, and then principles for how we were going to work together, and then a container for ongoing governance of the system. So that was what came out of the project, and just I'll just share some reflections on the process and just the constraints and what we would potentially do differently next time. So in terms of what came out of it, it was actually quite challenging to then translate that into a plan that government could accept, and trying to change that process into a language that would sit well with government. And it was a 12-month process that we went through, and we got a lot of really significant engagement, but then trying to make sure that that was seen through in terms of implementation was really challenging. So if I was going to do it again, I would definitely put some energy into building capacity in the system to really implement this work, and potentially take a longer term view over, say, 5 years rather than a year. So you could do a year's consultation and then do ongoing capacity building and maybe have some pilots, because it was really a statewide plan and it sat at a statewide level. It was really hard to see how implementation was then happening on the ground and really support that implementation. And the other challenge was just in terms of scope. So it was a plan for the health system, but actual healthcare only affects 15 to 25% of health outcomes, and the real big difference that's going to be made with health outcomes is looking at social determinants of health. So, looking at housing and education and employment and nutrition. And it was just a step too far for the health system at that time to be able to have a health plan that would be taking into account the social determinants of health as well. So that would be an opportunity, if you're going to do something similar again, to really try and broaden the scope and broaden the system to look at social determinants of health as well. So thank you. That's the case study, and I'll leave it there.